Today we are going to talk about antimicrobial resistance, the background and the burden. Now for that we should know what are antimicrobials. Antimicrobials are the medicines used to prevent and treat infections in human, animal and plants. And that includes antibacterial, antiviral, antifungal, antiparasites, antihelminths and so on. Now, what are antibiotics? Antibiotics are the medicines used to prevent and treat bacterial infections. So these antibacterials and antibiotics, these are the terminologies which we can use interchangeably. So what are antibiotics? Antibiotics are the medicines which are used to prevent and treat the bacterial infections. Now what is this antimicrobial resistance? This antimicrobial resistance occurs when bacteria, virus, fungi and parasites change over time and no longer responds to the antimicrobial agents. Means there is a mutation, there is a change in the genetic makeup. So there is a change over the time and they will no longer respond to the antimicrobial agents. Means we can say that initially they are sensitive, later on they become resistant. So acquired resistance, and this acquired resistance makes infections difficult to treat. It increases the risk of disease spread, increases the severity of illness, and ultimately death may also occur. Now what is the timeline of this antimicrobial resistance? Timeline of antimicrobial resistance, we all know that the discovery of penicillin, with the discovery of penicillin, the golden era of antibiotics has begun. But before that, the pre-antibiotic era, in 1900, the top three leading causes of death were the infectious diseases. Top three causes of death were the infectious diseases. 1914 to 1918, in World War II, the more deaths because of the infectious diseases than the battle wounds, right? After that, in 1929, Fleming published that the first paper on penicillin. Actually, that era 1928-29, Alexander Fleming, he publishes the first paper, research paper on penicillin, but not on the human beings. Actually, in 1935, sulfonamides were, these are the first antibacterial agent. They are used systematically to treat the bacterial infections in 1935. After that, in 1941, the penicillin has been used in human beings, on human beings. So penicillin in clinical trial, right? Then after that, 1943, penicillin is given to the World War II soldiers for various infections. In 1945, within a year or within 3 to 4 years, Fleming receives a Nobel Prize and warns about the penicillin resistance. Warns about the penicillin resistance. After that, there in 1948, the penicillin resistant staphylococcus era is declared as a global pandemic. Right? Now the 1950 and 1970s, over 20 new antibiotic classes are discovered in that 20 years. 1950 to 1970, 20 new antibiotic classes are discovered. This is we called as the golden age of antibiotics, that era. But again in 1961, again there is a MRSA, that is the methicillin resistant staphylococcus aureus, is documented globally in 1961. Then in 1970 to 1980, in that 10 years, over 60 antibiotics are released in the clinical market. But all these drugs are the me too drugs. There is a slight molecular modification in the chemical structure and there is a appearance of new drug in the market. So we call it as a me too drugs. Then in 1987, Lipopeptides are the last class of antibiotics successfully released to the market. Then in 2013, there are the millions of antibiotics were used in the agricultures. Then 2001, WHO declares the antimicrobial resistance as a global public health concern. As a global public health concern. And nowadays, 2015, the colistin resistant MCR1 gene was first reported in 2015. After that, in 2017, a clinical Klebsiella pneumoniae strain is resistant to all commercial antibiotics. And in 2015, it may be 10 million antimicrobial resistant related deaths predicted each year. So just imagine what should be the consequences of this. Now, why antimicrobial resistance is a global concern? Because of emergence and spread of drug resistant pathogen that have acquired new resistant mechanism. New resistant mechanism has been acquired by these drug resistant pathogens. Not only that, transduction, transformation, conjugation, these are the older ones, but they have developed some newer resistant mechanisms that threaten our ability to treat the common infections. And especially alarming is the rapid global spread of the multi and pan resistant bacteria. We call it as a superbug, which is resistant to everything, and that is not treatable by the existing medicines at all. Now, what is the mortality associated with the antimicrobial resistance? A recent systematic study or analysis shows that the global burden of antimicrobial resistance in 2019, reported in the Lancet, indicates that 4.95 million deaths associated with bacterial antimicrobial resistance in 2019. 4.95 million deaths. Then at a regional level, all age death rate attributable to the resistance. Highest in the sub-Saharan Africa, 27.3 deaths in 1 lakh. Lowest in Australia, it is 6.5 deaths per 1 lakh. Then LRTI, low respiratory tract infections like pneumonia, these are the most burdensome infectious syndrome and which may lead to more than 1.5 million deaths. So this is the mortality. Now, what are the 6 leading pathogens which are associated with the resistance and that may lead to death? 6 leading pathogens for the death associated with the resistance is the E. coli, Staph aureus, Klebsiella pneumoniae, Streptococci pneumoniae, Acinetobacter baumannii, Pseudomonas aeruginosa, MRSA causing more than 1 million deaths. Other organisms which are causing 50,000 to 1 million deaths like MDR TB, that you can exclude XDR, tuberculosis, third generation cephalosporin resistant E. coli, carbapenem resistant Acinetobacter baumannii, fluoroquinolones resistance E. coli, carbapenem resistance Klebsiella pneumoniae, third generation cephalosporin resistance to Klebsiella pneumoniae. Now, morbidity which is associated with the antimicrobial resistance, Enterobacteriaceae. The common bacterial infections such as UTI, sepsis, sexually transmitted diseases, diarrhea, they have very high resistant rate worldwide. And for example, ciprofloxacin resistant E. coli, the antimicrobial resistant increases from 8.4% to 92.9%. For Klebsiella pneumoniae, it is increased from 4.1% to 79.4%. So major cause of hospital acquired infections such as pneumonia, sepsis, infections in newborn and ICU patients. These are all the hospital acquired infections. In some countries, carbapenem is not effective in more than 50% of this infection. So what we have options like colistin. Colistin will be the only last resort for the treatment of life-threatening infections which are caused by carbapenems, resistant Enterobacteriaceae like E. coli and Klebsiella. But several countries report colistin resistant for which there is no effective treatment available. So just imagine what is happening. Mycobacterium tuberculosis. In 2018, WHO estimated that 500,000 new cases of rifampicin resistant TB, globally of which majority are multi-drug resistant tuberculosis. 3.4% of new TB cases and 18% of multi-drug resistant tuberculosis. This is a major threat to society because there's the highest burden of the multi-drug resistant tuberculosis. 27% of the global TB cases are in India, out of which 27% are multi-drug resistant tuberculosis. Proportion of multi-drug resistant tuberculosis new cases directly came as a MDR TB cases. Out of 2.84%, means out of 100 there are 3 patients, they directly came as a MDR TB. And previously treated patients, MDR TB is 11.6%. Drug resistance in viruses, they are most common in the immunocompromised patient. There is increasing concerns in the immunocompromised individuals. All antiretroviral drugs includes newer classes at risk of becoming partly or fully inactive because of emergence of HIV drug resistance. So level of pre-treatment HIV drug resistance among infants is alarmingly high in sub-Saharan Africa. More than 50% of infants newly diagnosed with HIV carries a virus resistant to the non-nucleoside reverse transcriptase inhibitor. And this leads to the addition of dolutegravir as a preferred first-line treatment for adults and also in children. Drug resistance in the malaria parasites, which is very common. ACT, artemisinin combination therapy, is a first-line treatment for uncomplicated Plasmodium falciparum malaria. Partial resistance to artemisinin and resistant to the number of ACT partner drugs confirmed in the several countries through thorough studies conducted between 2001 to 2019. Now, drug resistant in the fungi. Again, this occur in the immunocompromised individuals. Prevalence increasing and exasperating the already difficult situation, means underlying HIV infection, already immunocompromised, and prevalence increases. Drug resistant in a Candida auris. Drug resistance which is seen in the Candida auris, which is the common invasive fungal pathogen. It is one of the most common invasive fungal pathogen, and this Candida auris is resistant to the fluconazole, amphotericin B, voriconazole. Now all this lead to the economic burden. The CDC estimated that the cost of antimicrobial resistance is 55 billion every year. In the United States, 20 billion for the healthcare and about 35 billion for the loss of productivity. Recent research by the World Bank indicate that antimicrobial resistance would elevate the rate of poverty and impact low income countries compared to the rest of the world. Just like humans, not only humans, but also it will going to affect your animals. The effect on antimicrobial resistance to animal will be due to mortality and morbidity. The increase in the resistance to antimicrobial will make treatment on animal ineffective and cause infections to become more severe. Now, what is the association between antimicrobial use and emergence of resistance? Antibiotics can be bought for the human and animal use without prescription. You can directly borrow the drugs or medicines without prescription. These are just like OTC drugs, over the counter drugs. You just go to the pharmacy and ask for any antibiotic, you will get it. So it is just like OTC drug, and that may lead to the emergence of resistance and disease spread. It will had gone worsen day by day. So lack of standard treatment guidelines that may lead to the overuse by the healthcare workers, means it is given as a supplements. Whenever you have seen these are the viral infection, there is no need of any antibiotic, but still we are giving that antibiotics on and on. Antibiotics are widely used for growth promotion and to prevent diseases in healthy animals and food industry. Not only in humans, but it is also given in animals, and also it is given in the for the farming or food industry. Recent study analyzing drug utilization according to the AWARE classification indicate that inappropriate use of antibiotics is widely prevalent in India. So what is this AWARE classification? AWARE classification means they are categorized under excess category, 27%. They are easily accessible, 27%. The 54.9% they are come under watch category. 34% out of that they are FDCs, antimicrobial agent. They come as a fixed dose combinations. So aware classification will give you the inappropriate use of antibiotics. Now, what are the main drivers for emergence and spread of the antimicrobial resistance? Misuse and overuse of antimicrobial agents, lack of access to the wash criteria. Now, what is this wash criteria? Clean water, sanitization, and hygiene. So, lack of this, poor infection and disease prevention control in healthcare facilities and farms, poor access to the quality medicines, vaccines, diagnostics, lack of awareness and knowledge, lack of enforcement of the legislation. So, in short, antimicrobial resistance is a global concern. Not only in India, it's a global concern because of high morbidity and high mortality. Important bacteria and pathogens which may lead to the death also, like E. coli, Staphylococcus aureus, Klebsiella pneumoniae, Staph aureus, Acinetobacter baumannii, Pseudomonas aeruginosa, MDR TB, and ultimately that all this lead to the economic burden that we have just seen. So multi-sectorial approach involving stakeholders engaged in the human, terrestrial and aquatic animals and plant health is needed to contain the menace of antimicrobial resistance. That's all.